What core technologies do you think need to be in place for health systems to become really a digital business or a digital platform for business?
I think what you have to do is you really have to empower the patient slash consumer. I'm going to use that interchangeable because to me it is interchangeable. The patient actually has made a commitment to come to your organization, but the next week, they are a consumer again making choice. So to me, you got to be able to put the information to make those decisions in their hands. When most of us do, transfer money to our children or somebody else, they need to pay a bill, we pull out our phone and we make the payments that way. You want to purchase something, you're sitting there in your car driving along in the passenger seat, and somebody says, hey, we need X. You pull out your phone, you buy that hat, you buy that piece of thing. When you want healthcare, I don't think it's become a habit yet that you just pull out your phone and you deliver that service. I do think it's going to grow. Now, that's where I think you see probably some alignment with banking, where banking had big banks, where we had hospitals, then you had branches, and we had urgent care centers and physician practices, and then we had, urgent care centers, and they had kiosk machines. You see a lot of things that are happening that way, and now I think it's mostly in your pocket. So for me, I think the number one thing is to be able to go to the patient where they want you to be at versus to having the patient come to you. And that's going back to 10 years ago when we all got into telemedicine. And every article now that I read recently kind of continues to show the amount of savings that is occurring, not only in terms of that actual cost for that visit, but also the repeat and the recurring afterwards. I read something this past week that talked about if somebody had a virtual visit versus a visit with a primary care physician, there is less likelihood that that patient will show back up again for any kind of healthcare service within the next 3 weeks. But if you do it to primary care, they're going to want a follow-up visit. So from that standpoint, you start seeing the costs going up when you start doing it the old-fashioned legacy way. And the new way, by having it in your pocket, you're kind of one and done. And if he or she needs to reach you, most of us typically have our phone in our pockets at all times anyway. You can access that information real time.